Hi Krishna, in here we have Dwight, he's a 22-year-old male, he is post-surgery, he broke his left femur skateboarding, so he's had surgery for that. Obviously he is awake, but he's complaining of pain, he wants Dilaudid. You're supposed to be anxious. He became anxious when he realized that he's in traction, he's got a 5-pound weight for his traction. And he's calling his mom repeatedly during this report. His last vitals in neuro was 4 hours ago, and they're...
Is it supposed to look like this, though? With the stitches and the stuff hanging off my leg?
Yes, sir. Well, the stitches, obviously, it's from the surgery. They had to cut you. The weight is to keep your leg immobilized so that it can heal correctly.
I'm not sure about that. I need to call my mom.
Okay, you can call your mom.
Okay.
His blood pressure is 110/62, heart rate 96.
Is it time for my pain medicine yet?
Not quite yet. I'll have to look up and see when your next dose can be. His resting rate is 14. Don't know. It just says POX. And his oxygen is 96%. His last
When am I
meal
getting discharged? How long do I have to be here?
Well, we're gonna have to let the doctor decide that. In the meantime, we're gonna take care of what you got going on, your pain, and your make sure you don't get an infection and that type of thing.
Damn.
It'll be alright. His last neuro assessment was negative, and his last pain medicine was given 3 hours ago. I don't know what PCN is.
Penicillin.
And he has an allergy to penicillin. A minor allergy to penicillin. He just gets hives. Any questions?
All right, Mr. Dwight, I'll be back in to check on you in a few, okay? Anything you need right now?
When do I get my pain medicine?
We're gonna, what's your pain level right now?
I don't know, probably about a 4 or 5.
A 4, where is it?
In my leg.
And can you explain to me what it feels like?
Probably like a stabbing pain.
Okay, all right, we got you.
All right.
We'll be back.
Okay.
Where's the thing?
Kim and Jim will be on the meds. That's for seizures, epilepsy, and so we'll go back and check his chart. He can have oxy for his pain medicine.
Y'all can come a little closer over here to me.
Who's up there now?
Just looking at his, he's getting.
Y'all not giving me.
First dose now, okay. So, 7.
It's okay to have the discussions closer to me so we can hear you. The discussions are important, so you can come over here beside me and close to me in this section here and have any kind of discussion. That way it's thank you.
Ask you about the sulfuric acid. Okay, well, I guess I'll go in the room and ask about that. I see on here you have, valproic acid. Do you have a condition that requires that medication? Seizures or,
Migraines?
Nobody ever told me I had seizures.
You never had a seizure before?
Not that I know of.
Okay. So,
ADHD,
Bipolar? You bipolar?
I don't know. I mean, I was seeing somebody.
You've seen a therapist?
I don't know if it was a therapist or not, but I was a little depressed one time. But that was a long time ago.
So do you take, that medication at home, valpuric acid? 500
I
milligrams?
take it sometimes. I mean, I don't think I need it though.
So you had it as a home medication?
Yeah,
Okay,
that's what they say. I
alright.
just take it.
Can you tell me again, what was your pain level?
It's
Of
about,
1 to 10?
it's gone up to about a 6 now, you know,
About a 6?
yeah.
Okay. So verify the medications. You want to check? Okay.
Knock, knock. Hey, Mr. Dwight, I'm coming in and doing an assessment on you.
Okay,
I'm sanitizing my hands, okay?
okay.
Alrighty. Take a look at you. I know you said your pain was getting about a 6. You still feeling stabby?
Yeah, yeah.
What's your name and can you tell me your name and where you are?
My name is Dwight Huslin. I am at Huntsville Hospital, Maine.
And what's the date?
Today's the, I think today is the 19th.
No, it's not the 19th. Can you tell me who the president is?
Oh, it's the 18th. Overslept, I think.
Oh, so, okay.
Yeah.
I'm gonna take a look at your legs, okay?
Okay.
You want your socks on? Or you want
Oh, no, that's fine. You can leave them on. I like to stay warm. It's
So I need
cold
to
up
check
in
the
here.
color of your extremities. Pretend, okay, okay.
These tent stockings, I don't feel like taking these tents off. But you can say it out loud.
Okay. There's no skin color that's normal for ethnicity. I'm gonna touch you, okay? I'm gonna feel your pulse.
I thought my pulses were on top of my feet.
I'm gonna check back here. There's pulses back here too.
Oh, nobody ever told me that.
Can you feel me touching you?
Yeah, I mean, a little bit more, you know, on the right, but, you know, but I can still feel it.
Okay, what about this?
I'm ticklish, yeah.
You can feel it over here?
Mhm.
Can you wiggle your toes?
Yeah, I can wiggle.
Like that?
Mhm.
I think that's it. Okay, that's it. We'll be back with your pain meds, okay?
Okay, everything okay now with that?
You said that you can feel more on the right side than the left, so
But I can still feel it.
still feel it, but it's a little bit.
Mhm.
I didn't see any swelling or anything. So.
Yeah.
But we'll be back, okay?
Okay. I mean, my hip, you know, is, you know, I mean, it's down there, I feel it, but I still feel the pain around the part where I had my surgery and my hip part too.
You still feel that?
And that's where around the 6 is too. The 6
Okay.
pain, when I move around.
Okay. All right. Thank you.
Okay, guys.
I see that you have a saline lock on your right.
What your name is?
I'm Melissa.
Oh,
I'm Melissa.
oh,
I just came to check your saline lock and see if I need to give you any fluid. I'm gonna go ahead and wash my hands.
okay.
Okay. Raise the bed up a little bit so I can get closer to you.
All right.
Okay, you do have a saline lock. I'm gonna go ahead and give you some fluids because it looks like you haven't eaten since 11 o'clock last night.
Yeah, what's going on with my tray?
I'll check on that for you.
Man, this hospital's slow. I was supposed to get a tray. They said I was gonna get one, but I still ain't get shit yet.
Okay, well, I'll check on that.
All right.
So in the meantime, we'll go ahead and give you some fluids to get you hydrated,
All
okay?
right.
Alright.
Alright, so me and you looking at his labs, his sodium is 148. His,
Hang on over here.
you wanna take a look? Okay,
Should we go to the?
Okay, well, Mr. Dwight, me and somebody here have been reviewing your lab results. We see that your complete metabolic panel that was drew, your sodium is a little elevated, it's 148. Your potassium is 3.9, so we're not concerned with it. Your BUN is 26, your creatinine is 0.9, and your glucose is 92. Your creatinine clearance is 52, which is a little low on our side. When you're urinating, are you having any burning sensation or still feeling like you have to urinate even when you finish going? Or pain?
Not really, I don't feel nothing different.
Okay, have you still been going to the bathroom like you're supposed to?
Yes, I've still been going all right, you know.
All right, well, due to your sodium being a little elevated and your BUN being a little elevated, elevated, and your creatinine clearance being a little low, we're gonna go ahead and get you started on some lactated Ringer's fluids, okay?
Oh, okay, what's that?
What is his
Creatinine
creatinine?
fluids
A
is
little
low.
elevated, yeah. 0.9 what? Normal saline got sodium in it. We don't want him with the sodium. We're gonna get LR. LR is more equal to the natural fluids that's flowing in the patient's body.
What y'all talking about?
We're talking about the fluids that we're gonna give you, because we're gonna have to call a doctor and have them give us the fluids. Put the order in for the fluids.
What I'm gonna get?
You're gonna get lactated Ringers.
Oh,
Do you know what that is?
I don't know.
Okay, it's
As long as
fluids.
y'all know what you're doing.
Oh yeah, we know what we're doing. It's fluids for us to get you going to the bathroom, see if we can get that sodium level down, as well as your creatinine and your potassium.
Okay,
It's not too high, but we don't want it to get higher than what it is.
all right.
Alright.
Okay, and since I am here, I wanna go ahead and check your vital signs. Okay, so,
Yeah. I don't need that part, cause my blood pressure, my heart.
alright. Let me get your arm, please.
That other, tech that came in here said that, you know, they gotta go on the opposite side of my IV. You're the first person that doing my blood pressure on this side, and my IV's on this side. Is that the way it's supposed to be?
Girl, stop that thing.
Well,
The other nurse, what did she say your name was?
Melissa.
Oh, she said my IV is over here. So,
I'll take it on the other side to get more accurate reading.
okay, all right, well, that makes sense, cause everybody else been doing it. I'm just saying, I don't know what school you went to. You can be joking instead.
Okay.
It's kinda loose though. It's like gonna fall off of me.
I gotta come up this way.
Damn, girl, what floor are you from? How long you been working here?
It's been about 3 months.
3 months? Oh, you kinda new.
Mm-hmm.
You got a boyfriend?
Yeah.
Gotta make sure you have your legs, cause you should be.
Alright, Mr. Dwight, so your blood pressure is very low. It's a 94/48. Heart rate is 106. Temperature 37.4. Respirations 14. And it looks like your O2 set is low. I am going to go ahead and contact the doctor.
What's O2 stat, what's that?
It is to see your oxygen level,
Oh, okay,
and it's at a 93, and it's supposed to be 95.
oh, okay,
So I am going to talk to the doctor about that.
okay. Alright,
Right back.
what you said supposed to be? My what?
Your
My
O2
oxygen?
setting is supposed to be at 95 to 100.
Oh.
So it is running a little low, and your blood pressure is very low. Are you feeling okay?
All right, I feel okay. I'm a little, I get a little shortness of breath sometime. I notice,
Okay.
but I feel
I'm
a little
gonna report
dizzy
that right
sometimes,
away.
but it's normal.
I'll
Okay.
be right back. Okay, guys.
You gotta wait. You gotta do it again.
Hello,
I still
Mr.
have to take the medicine.
Matthew. I'm Melissa back again. I came to go ahead and infuse your IV, normal saline lactated ringers.
Oh, okay.
I'm gonna do it over 6 hours,
Forgot to
167.
change the name of the way. Okay.
Go ahead and sanitize my hands.
Okay.
I have the fluids. Are you allergic to anything? Do you know of?
Somebody told me I was allergic to penicillin, but that was a long time ago.
Okay. Well, this doesn't have any penicillin in it. Okay.
Okay.
Alright.
Okay.
Got this going to 167 over 6 hours.
How fast is it supposed to be going?
It's gonna go in at 167 milliliters over 6 hours.
Oh, it's gonna take 6 hours to finish?
Yes.
Damn. Okay. Can I get up and go to the bathroom with that?
Yeah, you'll just call us. You have your call button right here.
That's all right.
Oh, yeah. Yeah. We'll put in a Pure Wig, a male Pure Wig for you.
Oh, Pure Wig.
Yes.
What is that?
It's what you'll urinate in, unless you want to urinate. But if you have to do number 2, we'll have to put a basin underneath you.
A basin?
Yeah.
Hell no.
That's what we'll have to do, because you do have that traction right there.
Shit. Okay.
Let me take a
Whatever.
look at your labs real quick, okay?
All right. Bullshit.
And this is my, this is another nurse. We're both gonna go ahead and look at your labs. This is D.
Okay.
Okay.
What y'all talking about?
I do see that your, white blood count, yeah, we're just reviewing your labs. Your white blood count, came back a little elevated. And we're gonna give these readings to your doctor, and we'll be back to see what he wants to do.
What's white blood count?
Like risk for infection.
I got an infection?
You're just at risk for it.
Oh, what it say? What my numbers in?
It's 13.5.
What's normal? What's it supposed to be?
Between 5 to 10
Below
thousand.
13.5.
What?
Below 13.5.
That's not telling me what it's supposed to be.
This too high.
Where school you go to?
10,000.
I don't want her as my nurse. She didn't even answer my question. I asked her what it's supposed to be. She said below 13,000. I didn't tell me the answer.
Between 5 to 10,000, you're at 13.5 thousand.
Okay, that
So
makes
we'll
sense.
go ahead and phone the doctor, see what type of antibiotics we're gonna put you on since you're allergic to penicillin.
Okay, I'm gonna keep you as a nurse.
Alright, we'll be back. We'll go ahead and give your call bell. Need anything from me?
My pain is about a damn near 9-10 now. Shit, I called a long time ago for some pain medicine.
Okay.
Fuck how long I gotta wait for some pain medicine around here.
Last night came
Is there a
Mr.
charge
Dwight.
nurse?
Dwight. You finally
Yeah.
came in with your pain medicine. We had to do the neurovascular assessment to just make sure everything was okay before we gave the medication for you. And we do have your Dilaudid, because your pain level was at a 7, okay?
Oh, damn time.
Oh man, I'm sorry. I'm
All
sorry.
right. I'm gonna go ahead and take another set of vitals on you.
Yeah, because she did tell me that your oxygen level was low. Are you having trouble breathing?
Every once in a while I get short of breath.
Short of breath?
Yeah.
Are you like, short of breath when you move, or just short of breath just sitting there?
No, it's short of breath. I mean, I guess that it's just a little, you know, I just feel a little winded all of a sudden, you know.
Winded? Okay,
Probably about 30 minutes now, something like that.
30 minutes.
Alright, so we're gonna take your vitals.
Put this on for me, please.
Am I alive?
You are definitely alive.
She looking all funny, what it say?
Well, your blood pressure is running at a
I don't see it. Where it say that?
It's down at the bottom.
Okay.
But your oxygen is still low. You don't have a PE for real?
I don't know, for real, for real.
Mr. Hudson? Put this on your finger. I need Jenna and Nurse Kim, please.
Well, y'all got them little walkie-talkies too?
Yeah. Special Agent Oso. Blood pressure is 134/83.
Okay, sound about right.
Heart rate is 60. Oxygen 95. So you know that. Somebody can you take that off for me, please?
What did you need?
thank you.
Alright, we're gonna go ahead and make it on the thing.
Okay.
Are you still at 7?
Yeah, yeah.
Because it says respiratory failures, especially left for this patient. I feel like I should ask him if he's having trouble.
And I also got you some antibiotics.
What's your antibiotics y'all
So I
giving?
already took
We
it.
got the ceftriaxone and then
That's why I was
cefazolin.
confused.
Oh,
And
okay.
then we have, of course, your Dilaudid. I think that should be it.
Okay,
Lovenox also.
all right.
And the Lovenox, we're getting that for you to prevent blood clot.
Oh, okay.
Should have asked him, is he having trouble breathing and stuff. I did. Oh, you did already? What did he say?
He said it went up to
He
a
said
7.
He was like, okay.
Alright. Good to go.
Is there anything else you need while we're in here?
And what's some other antibiotics I'm supposed to give?
Ceftriaxone and cephalosporin. Don't know how to pronounce that one. Cephalosporin.
Cefalozolin?
Yes.
Cefazolin.
Cephalosporin. What am I saying?
Ceftriaxone and cefazolin.
Oh, okay, Cefalozolin, okay, I ain't never heard of what you said.
Yeah, sometimes. I'm from the north, we talk weird.
Well, I'm from the south. Okay. And both of those medications okay? Cause I am allergic to penicillin.
Yes,
They
they're,
good?
they're not
Cephalosporin.
penicillin based.
Oh, okay, alright. Alright.
Need anything?
Oh, I better call I think I better call my mother again. I'm starting to feel weird.
Can you
Call.
explain that feeling to me?
I don't know. I just feel like I'm feeling a little short of breath, but I mean, I guess it could be, normal. I don't know.
I say your oxygen did, when we rechecked it, it was at 95.
Okay, it was okay.
It's
Alright,
just a
I feel
little
still-
short of breath, it's not like,
But I don't know.
like you're struggling, it's just a little bit, or
I don't know. I
do
just
you
feel
feel like
kind
you're
of weird,
struggling?
but it could be normal. I don't know. Yeah, I don't know. All right. Well, we'll
We're
see.
gonna listen to your lung sounds, okay? Let me get a stethoscope.
Yeah. It was just weird. It just kind of hit me all of a sudden. Just a little bit of shortness of breath, but, like, I don't know. I mean, I can still breathe, but it just feels a little weird.
It's this a little weird, you're not liking it, it's not causing you to panic or anything like that, just, just kinda going with the
I
flow,
just
huh?
might feel just a little short of breath. Yeah.
Okay. So you're gonna listen to your lungs and see what they sound like.
Okay.
Breathe in and out. Take a deep breath in, out. In. Out.
Is that Bath and Body Works you got on?
I smell good.
I had a lady tell me I'm allergic to perfume. I said, girl, that's air freshener. Get on this toilet.
Check it back.
Can you sit up for me?
I don't know. Is this hip okay? I mean,
Yeah, I don't think we're gonna do that with the head.
Huh?
So you're okay. So I will be back. I'm gonna go report these findings to your doctor.
okay. All right.
Why y'all ain't lift him up with the hip?
You can roll.
And then,
Oh, he on
depending on what
5
they.
pound thing, yeah.
I still got to listen to it one way or another. You are supposed to
We
be
on
making a
you, Miss Ray.
similarity between this and another patient.
You had a patient before, yeah. You did today. What they had? Am I supposed to look back in there?
Yeah.
Yeah. But she's supposed to discuss that in front of the patient? Like what might be wrong with you? Or you're not the patient right now. Go ahead and discuss.
Just thinking out loud. Discussing it right here.
Oh, dude.
So we're technically not here.
Yeah, I want to see you here discussing it.
He said it was all of a sudden that he got short of breath. He's feeling anxious.
So what a PE? Could that be our discussion, or you
You
just
can
want me to come over here?
discuss that within yourself right here.
Who am I discussing it with?
Girl, think
Right
out
here in the
loud.
camera, and make it make sense. Just
Not in the
discuss and
camera.
talk. Mhm.
Boy, what's that saying?
Sudden short of breath.
Okay, well, with the sudden shortness of breath and his.
What? I can't even hear you.
I thought you said you were
With the
discussing
camera.
out loud. Oh, okay. With the sudden shortness of breath and the O2 stat being 93, and from Krishna's respiratory assessment, it seems similar to a patient I had 6 months ago who had pulmonary embolism.
You sure you know what you're thinking?
I'm positive.
What is pulmonary embolism?
Pulmonary
And what that got to do with me? I heard you were talking to yourself out there. What that got to do with me? What is pulmonary embolism? What's your name again?
D.
Okay.
Pulmonary embolism could be a clot that went to your lungs, and that's causing the sudden shortness of breath. That's why you're having difficulty breathing.
Oh, that's what that is.
Yes.
Okay. Anything else? I don't think I have pulmonary embolism. I'm getting Lovenox, ain't I? One nurse said that, I forgot who it was, said that it kind of helped preventing blood clots or something. So why would I get a blood clot if I'm getting something for it? Anything else?
I mean, you just had surgery. You're not really moving around, so you're still at a risk of getting clots.
Okay, that's why I'm
It's a
short of breath.
possibility. We still gotta find out and see, but
Okay.
yes.
How are you all gonna find out? What you all do?
Ultrasound.
Ultrasound? That's what I'm thinking, a chest X-ray or ultrasound? Ultrasound or a chest X-ray?
An ultrasound on my chest?
Ultrasound or a chest X-ray?
I have a DVT too. And then
Yeah, but they're on Lovenox, or he's on Lovenox, that's when he brought up about the
Lovenox
chloroplasts.
only prevent them. It doesn't do anything to a clot if it's already there. And we need to do some blood cultures. Make sure there's no infection in that hip or femur.
Are you my nurse today?
One of them.
Okay,
She just got a little birdie on her shoulder.
okay.
You have any other questions?
Not right now.
Was her assumptions correct? That's what it say on the paper. Okay, that's what I was thinking.
Oh, I'm supposed to discuss this with you? Oh, you're the church nurse? Great, no. Okay, so you discuss the
We
fact.
can discuss it over here in the camera out loud so we can all hear. Be careful. Just come over in the camera so we can all hear you, please. Thank you, Jenna.
Okay,
Thank you.
would this like better?
Discuss these with you.
Okay, so the patient is having sudden shortness of breath, he feels winded, and his O2 louder.
Yes.
Okay, so the patient is having sudden shortness of breath, he feels winded, his O2 is 93. And then he just had surgery on his femur, so that could be a possibility too. After surgery, he needs to go on, hypocaudric. Let me see if there's anything else. And then from Krishna's respiratory.
Was he placed on any type of oxygen? Are we in the room? Just like outside the room.
Where it say he can't ambulate.
I think we're outside the room, but still it's loud enough so we can
Leg exercises. No, wait a minute.
Angela,
Alright.
so what you all find out?
She was just giving
You're
me.
the charge nurse, right? You're supposed to know everything.
Okay, well,
So what's going on?
I'm gonna say that we're gonna take you for a chest x-ray and, or I'm gonna let your provider know all of the things going
You're short
on.
of breath. That's why?
I would think so, yeah, you're short of breath and, you're feeling kind of anxious. I heard you say you were trying to get hold of your mom, you were a little worried about that.
Yeah, yeah.
And,
I never felt this short of breath before.
Are you having trouble breathing right now? Would you like some
I don't know, it just
oxygen?
feels weird, you know.
well, it doesn't say it on here, but I think you should get some oxygen. I think we should put you on 2 liters. I think we should stick you
Y'all
on
the
nasal.
nurse. I mean, what y'all gonna do?
Okay, well, I'm
Y'all
gonna
let
stick
me
you
die
on.
up in this bitch?
I am not, you're not gonna die.
Krishna's so dramatic.
Okay, so I'm gonna put 2 liters of oxygen on you for now. We're just gonna monitor your breathing and I'm gonna let your provider know and we're gonna take you for, the chest x-ray.
Okay, alright.
Alright.
Thank you.
Your call ladder's right there. If anything worsens, you call us, okay?
Okay, bet.
Alright.
He's so dramatic.
All right. I'm gonna go on ahead and pretend that you diagnosed with
A DVT and the chest x-ray came back showing that you have pneumonia. Let me see. Yeah, PE, pneumonia. So, what am I supposed to be doing? Okay, pulmonary embolism is what the 3 possible causes for the change in the plan in our interventions is I'm gonna need you, I have this incentive spirometer. This is something that all of our surgery patients use, being that you just had this femur surgery. This will help you to open up your airways, and then we're gonna pretend I'm showing you how to properly use the incentive spirometer. And you're gonna do this at least 10 times at least while you're up just sitting here watching TV. Take a few breaths, help open up your
What I'm
airways.
supposed to do with it?
You're supposed to take it in and take a really deep breath and blow out as hard as you can. That's just gonna open up your airways so that we can make sure that you get proper perfusion through your air. You know, being that you're short of breath anyways, it could be a reason that you have pneumonia, not properly breathing after that surgery. Also, let me see, 3 possible
I mean,
causes.
I had like surgery before. Is it that thing, that blue thing?
Yeah, it's plastic. It almost looks like a little toy.
It's got a little ball in it?
Yeah, you gonna move
I
that
had
ball
one of
up and
those
down.
things before. Then the last time I had one, this other person told me I was supposed to inhale in it and suck into it. You tell me I gotta blow into it. What y'all talking
Oh,
about?
no, you, of course, in order for you to exhale, you gotta inhale, so you're
But
gonna
you
inhale.
say I'm gonna blow real hard. Damn.
Okay, well, I take that back. I want you to inhale real hard and then you're gonna blow out. And it's gonna help open up your airways.
Wait, I'm gonna inhale real hard and blow out?
You're gonna do both. Inhale and exhale through the incentive
Y'all
spirometer.
confusing me. Where the charge nurse at?
Charge nurse.
Y'all confusing me.
I'm trying to think with the incentive. Yeah.
Breathe in.
Cause I had something
Inhale
before,
and then you breathe out.
and then somebody, this other nurse one time, when I had my other procedure one time, they gave me that same thing, and then told me I'm supposed to inhale in it,
Yes, you inhale.
and now I'm supposed to blow out real hard. Damn, this
No, you're
hospital
going
is
to
fucked.
inhale. You're going to inhale in the incentive spirometer. Yes, you are.
Sorry, Mr. Dwight, I mixed up the devices. I was thinking about another device called the flutter. You're gonna actually inhale into the incentive spirometer as hard as you can. In a little ball, you're gonna make sure that it goes up and down and try and beat the time before so that we know you're breathing adequately.
Oh, okay, alright, that makes sense.
All right, and then another cause for the change in what you got going on is, not moving around. PT and OT was supposed to come work with you. I hadn't seen any notes from them. Maybe we can possibly do some bed exercises to help you move around. That could be another indication for you, developing a PT.
Yeah, because ain't nobody checked my hips yet.
And then
I mean, I know I'm in traction, but shit, I could be bleeding and shit on the hip. Nobody even checked me.
we're gonna check
I
that
ain't coming to
too.
this hospital no more.
I hate to hear that. But then also, another indication, it could be infection. Like you said, nobody's checked the hip or the femur. Wound dressing may have not been changed. We need to get
it's
some
like,
blood
y'all can
cultures
still- aren't
drawn
y'all
on you
supposed to
too.
move me just a little bit to look at it? I mean, I've been still staying here in this thing. Y'all can move me a little bit. Somebody can move me and look at it.
Well, can you move your upper extremities and your other
I
leg?
can move it a little bit, yeah.
Okay, well, you gotta help
But
us
y'all
move
can
you
still
around
do
too,
it.
you know?
Shit. I mean, I'm the patient. Y'all supposed to be taking care of me, and ain't nobody even looking at my hip.
Well, I'll take a look at it right now. I thought it was the femur. What's going on with the hip?
It's the hip.
I was confused.
Well, they only did surgery on the femur. Did you hurt your hip too when you fell off that skateboard?
I thought I did.
Okay, well, I can
But,
take
you know.
a look at it, but we're gonna have to also contact the doctor and see if we can get an x-ray or a CT of the hip, because they haven't addressed that at all.
Yeah, probably because I've been sitting in the same position. My hip bone hurting me.
Okay, well, let me go call Dr. Davis and see if we can get those orders put in. How's your pain? It's been a little while since they gave you the medicine. Is it still at a 7?
The pain is a little better, but damn, y'all fucking up around here. 'Cause
All right,
ain't
well,
nobody.
we're gonna have to get it together. I'm gonna go
All
get
right.
with my charge nurse, see if we can call PT and OT, get them to come evaluate you so we know what we can do with you, okay?
Yeah.
All right, I'll be right back.
I'm gonna sign out of this hospital.
Oh, you said you wanted to leave AMA?
I'm gonna sign out because y'all don't even know what y'all talking about.
Okay, Kim and Samaya, y'all gonna transfer them in to ICU?
Okay, so we got,
Real short of breath.
okay, so far during your plan of care, we've given you your medications, and how are you feeling right now? Are you in any pain?
Man, I'm just short of breath. It's hard for me to breathe.
Let me look at your vital signs one more time. Let me see your O2. It's hard to breathe, you said?
Yeah.
Let me check your O2.
Well, sir, we're transferring you to the ICU.
Give him some oxygen.
Oh, goodness. So your O2 is in 80%.
That's what I was thinking.
He's on oxygen.
I'd already put him on 2 liters.
2 liters of oxygen? Okay, well, we need to go ahead and increase that. I can't do that without an order. Let's see if there's anything else we could have done.
Oh, man, I'm feeling uncomfortable. It's hard for me to breathe.
Let me elevate you a little bit more.
Girl, turn that oxygen up.
I can feel it.
You can put it up to 4.
Okay, I'm gonna put it to 4 liters until I talk to the doctor. But we are gonna go ahead and transfer him to the ICU.
All right.
Colorado
All these
response.
suckers, I don't want to die.
Colorado response.
Let me call my mama.
Did y'all get any orders? Did we get any orders for lactate?
We did blood cultures. He going
We
to
did
the
blood
unit.
cultures?
Rapid response. Can't breathe.
That's what we have done. We could have moved around, put him on DVT precautions. moving, I mean.
Yeah, I'm gonna call my mom. Feel like I'm a die up in here.
You can't breathe, you can't call him.
Well, we need to go ahead and transfer him to the.
Rapid response,